This is Dr. Mina Makary, JVIR Media Correspondent. I'm here today with Dr. Kei Yamada, Assistant Professor of Radiology at Emory University, and we are discussing TACE today. Thank you so much for joining us today, Dr. Yamada.
Oh, no, my pleasure.
All right, so you've had a pretty interesting talk here discussing different aspects of TACE. What are some of the key points that our audience should get out of the talk?
I think, the key points really are that, different institutions do taste very differently depending on the location, and practice patterns are very variable. And a lot of times there's no one right answer, but, there are, different ways of thinking about the same principles. And I think that, today's talk really highlights that. Even something as simple as pre-procedure orders and post-procedure orders are very different. The way that we deliver the medication is very different, but at the end results I think are fairly similar, that no matter what therapy, whether it is using conventional TACE or drug-eluting bead TACE, we do a very good job at controlling a small HCC, and I think that I think there's a role for either, and depending on what climate you practice in. The other thing that I really got out of this talk is that the role of cone beam CT and how important it is for treatment of these tumors, which are sometimes very difficult to see on the conventional angiograms. And I think that cone beam CT adds a lot to treating these tumors, especially for those who've been multiply treated, especially if they have extrahepatic supply. And I think that for patients, it is remarkable how well we can treat these tumors using these new techniques. And certainly I think in the future, as the cone beam CT gets better, faster, and less susceptible to respiratory motion, I think that it will probably even play a bigger role in how we do our therapies.
Well, it sounds a very interesting topic, and there's a lot of future things that may be arising out of this. And thank you so much for joining us today. And
well, thank you very much.
Thank you for the excellent talk.
All right.
Appreciate it. This has been Dr. Mina Makary, JVIR Media Correspondent, and thank you for listening to us.